So good to have you with us today. My name is Baylor Rice. As Tara said, I'm one of the pharmacists here at Revelation. I am in the clinical liaison division and head up the supplement division. So I've been trained in functional medicine, and that's really where we take the slant from, is really going back to an ounce of prevention's worth a pound of cure. So today we're going to discuss allergies, a variety of different supplements we can use and how those can impact the immune health. I'll let you read through the disclaimers real quick. And then for those that are new to us, I'm at South River Compounding Pharmacy today, but we're one of the family of network of pharmacies of Revelation. So here you can see we've got a variety of pharmacies, compounding pharmacies across the United States that really have formed together as a network, so we can kind of help with economies of scale to give our patients really the absolute best service and keep costs as low as possible for you, and really work together as a team. So if you're listening in another part of the country, we're forwarded the invitation via another pharmacy and wondering, well, why is this guy from South River speaking with me? Well, that's why. Really, I'm representing all of these pharmacies here today. So welcome. So really what we do at the Revelation family is compounding pharmacy is the core of what we do. We also specialize in natural medicine, vitamins, minerals, herbals, homeopathics, natural skincare and beauty care. We do offer personalized consultations with a variety of different people you can do. We've got training in functional medicine and integrative approaches. Now, with that, we're able to have at our disposal a whole host of a variety of different testing that we can look at, from saliva, urine, hair analysis, stool, looking at neurotransmitters via the urine, micronutrient, etc. To really, how can we take these in to help you get you in your health to where you want to be? And really where I start with my patients is the first thing I tell everybody is, you're the boss, you're in charge, it's your health. So how can I help you get to where you want to be? So a lot of times we'll really take symptoms, we'll take your history, personal history, as well as family history, and also what data that we have, and really blend all that together. So to get into what today is about allergies. So the immune system response to an external perceived threat is really called an allergen. And so these can be many different things. We can have contact with the skin from poison oak, poison ivy, or animal dander, pollen, latex are probably the most popular. You have injections, so you've got bee stings, medication. You've got ingestion you can do for both medication, nuts, shellfish, two very popular, can be severe allergy. Inhalation, certainly this time of year in the spring, as well as fall, we'll see pollen, dust, mold, mildew, as well as animal dander. So allergic reactions can happen, and you can come in contact with it via a variety of different ways. So the immune response, really the immune system produces the chemical messenger and this antibody, wait a second, it flipped ahead. I'm sorry. IgE in response to the perceived allergen, right? So in essence, what happens is the foreign invader comes in, hits the mast cell kind of goes, hey, you're cool, come on in, or no, get on out of here, and gives you that allergic response, if you will. That's really mediated a couple of different ways. One, it can be inflammatory, immune related, right? So that's why we see so many different reactions. So when an allergen connects with that IgE primary primed immune cell, it releases histamine. And so this is where a lot of people are familiar with taking antihistamines, right, to settle that histamine reaction down. So that's where that piece comes from. So atopic triad, so dermatitis, rhinitis, asthma, really there are similar types of immune reaction. Type 1 hypersensitivity, you've got the IgE mediated immunity, and then you also have a Th2 cytokine profile that can spill off immune symptoms. Histamine's released from your immune cells, both the mast cells and the white blood cells, basophils, as well as eosinophils, and this can cause an increased permeability of the tissues. Now, what I'll see a lot of times with patients when I work with them, for instance, is a prime example of food allergies, food sensitivities. Well, you've got a food allergy, right? And then we can have sensitivities to where maybe you don't mark off the reactivity to the test, but yet you're still sensitive to that food. And one thing that I'll see is in lab work, I'll see increase in eosinophils. So I'll see that number up. And a lot of times to me, that's a sign that, this patient is having some sort of reactivity to something that they're ingesting. So we need to kind of look and think about the diet. And so this permeability, if you've ever heard of a term called leaky gut syndrome, well, this is where this can kind of come from, right? So for instance, with the foods that we eat, come in, the proteins leak through that gut wall, come in and hit that mast cell. And that's where it's, again, I go back to the example of, hey, you're cool, come on in, or no, get on out of here. So when you're having that reactivity, that's what's setting off this variety of cascade of symptoms. So for some people, certainly we have the extreme, I can't breathe, right? Others, it's rashing, itching, hives. For some, it's gas, bloating, indigestion, reflux. Others, we can see increase in headaches, increase in, right, the rhinitis and the drainage and just the sniffly nose and congestion. We can also see things like, well, my left knee hurts, my right toe hurts. So again, it's not a black and white, I'm exposed to X and I have a Y reaction. It's really all over the board. And that's what makes it kind of difficult in many ways. So in this way, fluids and immune cells from the surrounding blood vessels can really kind of pour into that site. And that's where once you have that reactivity, then you've got that immune response. Histamine producing and releasing mast cells are especially numerous at the sites of easy entry into the body. So those are things, your nose, your mouth, right? We're ingesting those pollens and those dander this time of year, the mold, the mildew, internal surfaces of the body. So think about the blood vessels as well as the feet, walking barefoot on the grass, right? You can pick that up and that can permeate into the skin and into the system. So signs of histamine increase in tissues, certainly sneezing, right? That sensation of histamine. So the body's really trying to get rid of that. The watery eyes and the nose. So that hypersecretion, the nasal congestion and swelling, the dilation of the blood vessels and capillaries. So the fluids really engorge into those cells. You have pruritus, which is itching, and that reactivity, right? So, for some, it's going to show up on the skin, and there can be a delayed reaction. So some of the reactions can take up to 5 days. Most of the time, we're going to see it within 3, but I will see sometimes 5-day delay. And some things, of course, are immediate, right? And then, of course, you've got the bronchoconstriction with the asthma and causing those bronchioles and the passageways to kind of constrict, and harder time getting that carbon dioxide out. And so what do? We cough to kind of squeeze the lungs to get the carbon dioxide out. Of course, we want oxygen in, gets converted, and pull out the used as carbon dioxide. Neurotransmitters. These are other things that certainly can be impacted by the histamine response: the memory, agitation, cognitive function, appetite, temperature regulation, hormone regulation, body temperature, wakefulness, or other side of that. A lot of times get exposed to things and you'll notice, wow, I feel fatigued, I feel tired, right? Well, the body's fighting something. So it's pulling that energy and it's fighting that with that histaminic response. Schizophrenia we can see as well when the neurotransmitters get off. Gastric acid release. So this is where the endochromaffin cells in the glands of the stomach secrete the histamine. This stimulates the parietal cells to make stomach acid. So that's where your H2 receptor blockers for reflux come into play, right? So that's why those can be effective for that. But certainly we want to be careful and not use those long term. maintenance of libido and erections, orgasm sensation, of course, too, for women, changes in intestinal regulation causing diarrhea, and general vasodilation, so that nitric oxide mediated blood pressure lowering effect. So why do I have allergies? Is this nature? Is it nurture? Is it a combination of the above? Well, really, genetics are very complex. So you've got this non-Mendelian response, multiple interacting genes, non-genetic triggers can really determine that final expression of the gene. So those environmental factors. And really what's interesting when you approach it from a functional medicine model, 65% of genetics on average are modifiable. So just because we may be genetically encoded to something doesn't necessarily mean that we've got to say, hey, I've got to just wait for that gene to express himself. So what can we do to help modify that reaction as well as that expression of the gene? And then, of course, we've got the environment, right? So early childhood exposure to antigens, that hygiene hypothesis, which we'll go over that in a moment, the gut microbiome, your sinus microbiome, fetal and early childhood environment. So the maternal nutrition and allergen priming, childhood diet, were you breastfed, were you not? The introduction of whole foods and nutrients and the fatty acids and when that came into play. Our air pollution, our tobacco, the smoke, as well as how many different infections. All of those play a role with how things kind of express themselves. So the hygiene hypothesis, certainly protective influence of microbial exposures in early life on the development of allergy and asthma, altered diversity of the gut microbiota during infancy, as well as colonization with specific pathogenic and pathogenic bacteria, has been linked with an elevated risk of allergy. So again, what kind of scares me right now with, we're coming out of this COVID time, certainly that's still around, and I think we'll be dealing with that for many years to come. But, during this lockdown time to where we are all, and don't get me wrong, it's a good thing. Hygiene is a good thing, but also there's an overdoing it, right? Of using hand sanitizer all the time and let's just wipe everything out. Well, there's good bacteria there that does serve a purpose. So, how are we kind of messing with things long term? Question mark, time will tell on that. The sinus microbiome, right? So up here in the sinus cavities, once thought to be a sterile area. Now we really know that the sinuses house a complex and important diversity of microbial life. So frequent antibiotics can disrupt this and reduce the diversity of the sinus ecosystem. And this can, of course, lead to chronic rhinitis and more frequent sinus infections. So the gut microbiome, and this is interesting, the number of cells in the gut outnumber the number of cells in you 10 to 1. So there are 10 trillion cells of you, for instance, with your DNA, versus 100 trillion cells that are not you living in your gut. Wow, that's a really deep thought, isn't it? So this complex and diverse ecosystem really shapes and works with your immune system to determine the inflammatory responses throughout your body. So this is a lot of stuff going on, right? So, bacteria isn't necessarily a bad thing. It's just, do we have good bacteria? Do we have bad bacteria? What's the etiology of it ultimately, right? So your body is mostly microbes. Lung, large intestines. In Chinese medicine, the lung and the large intestines are really this yin and yang pair. So it's well known that inflammation in one can lead to or point to inflammation in the other. Treatment. Early childhood and fetal environments. We're going to look at sinus microbiome, the gut microbiome, natural antihistamines, sinus rinses, both antimicrobials, anti-inflammatories, probiotics, and allergy immunotherapy. So going back to the hygiene hypothesis with early childhood, so appropriate exposure during early childhood to a diverse microbial population is important in helping shape a very robust but not overactive and reactive immune system. against the backdrop of our genetic blueprint, really this determines our allergic potential throughout the rest of our life. So, if we are able to breastfeed and breastfeeding for a period of time, that's going to help with inoculation, and some other things, was it a vaginal delivery to where you got microbes through that, or was it a C-section to where the child wasn't exposed? All of that plays a role. Certainly omega fatty acid, omega-3s. I really recommend omega-3s from day of conception until the day you die. That's how important they are, from helping one side of the brain talk into the other, the gut, the inflammation processes, as well as immune system. Our pets playing in the dirt, not using antimicrobial soaps and household cleaners is recommended in early childhood. Certainly that, I'm not saying don't use those, but we've got to let kids be kids. We've got to let kids be exposed to things, right? Avoiding air pollution, avoiding the cigarette smoke and excessive environmental allergens in early life. It was funny, I was talking to a patient the other day, and very complex thing, and kind of going back to, remember you'd be in the car with your parents, and not my parents. My parents really weren't smokers, but certainly had friends and family members that you'd put the kids in the back seat, not worry about a seat belt, windows closed, parents chain smoking in the front. It was like an old Cheech and Chong movie when they'd opened the doors, right? Certainly we've gotten smarter and we've learned a lot as time has gone on. But we certainly also want to avoid this excessive and unnecessarily use of antibiotics, which can deplete, certainly, as well as dysregulate our internal microbiome, especially in the gut. Sinus microbiome, really restoring the sinus microbiome population diversity and number can help avoid these recurring sinus infections. We can do this a number of different ways. Certainly one is using like a neti pot, and we'll get to that in a moment, and then using different rinses in that to help and try to take out the bad bacteria. The gut microbiome, treat the gut to reduce the inflammation in the respiratory system, avoiding the foods to which you're allergic or intolerant. In other words, you're sensitive to, that causes a reaction. And typically when I'm doing food elimination diets with patients, I'll pull foods out for at least 30 days. We'll work. So that's removing. We'll replace with the good bacteria. We'll replace the good nutrients. We'll re-inoculate with probiotics as well as prebiotics. We'll repair it with glutamine and other essential nutrients and amino acids, and kind of help rebalance the system. So we'll pull foods out. We'll pull in the probiotics. We'll pull in a variety of different medical food, protein shakes to kind of balance things and kind of reassess in 30 to 60 days, depending where we are. And certainly if there's overgrowth, if there's leaky gut syndrome or something called SIBO, then we'll test, we'll repair the gut, we'll work on that intestinal impermeability. And certainly eating unprocessed whole foods, right? Real foods, as organic, free range as possible. Now, I'm certainly just touching on this today. If you want to dive further into this, we do have a webinar that's in our YouTube channel that we spent an hour alone just talking about gut health. So what are some natural antihistamines that we can use? Certainly quercetin, and having that in combination with some bromelain, which is a flavonoid, and vitamin C, that is going to help aid in the absorption of the quercetin. Certainly for acute issues, I'll use 2,000 to 3,000 milligrams a day, but ongoing anywhere from 500 milligrams on up. We'll use nettles, vitamin C. Vitamin C, basically what happens, how do you know when you get too much vitamin C? Vitamin C can have what's called an osmotic effect on the bowels. So it pulls water out, so it's a laxative effect. So, if you're cranking up the vitamin C and your stools start getting loose, that's a sign, ding dong, I need to back off my dose, okay? So anywhere from 500 to 1,000 milligrams a dose on up to 4,000 to 5,000 milligrams per day. N-acetylcysteine, which helps to increase glutathione, or we can do liposomal glutathione. Those are going to help decrease mucus, help decrease the viscosity of the mucus. So if we can thin that down, that's going to be easier to be able to cough and get that out. So for NAC, anywhere from 400 milligrams a day, and certainly we'll go higher than that. We'll even go up to 1,200 milligrams a day. Certainly there's a variety of different Chinese herbals that we'll use, kind of depending too, if there's microbes there, which herbal that we'll use is going to be dependent on if there was a culture and what the culture was positive or negative for. And as well, look at the sensitivity. So sinus rinses, especially if we have this gunk going on up here, using either the Neomed or a neti pot, rinsing those with those once to twice a day, even up to 3 times a day if you're acute or infected. The Neomed, you fill that up. You've got some packets that you can use with that for saline to help kind of balance the salt, squeeze the body, and it kind of goes up and out the other side. The neti pot, kind of similar, but that's using gravity, and you kind of hold it up to one nostril. Do it over the sink or do it in the shower. If you do it in the shower, though, keep in mind most neti pots are going to be ceramic. So if you drop it, it's going to break. So be aware of that. There's also some plastic ones. Personally, I prefer the ceramic ones, a little bit more hygienic, I feel. You can throw those in the dishwasher to clean. Using filtered water and a little bit of natural sea salt. You can also add in some grapefruit seed extract if you've got an infection going on, or a teaspoon or so of colloidal silver. This is where we can also add in the essential oils, the oregano or thyme, etc., depending if we've got a culture and what it's tested positive or negative for. So these are great, easy to use. Certainly you can rinse with just the saline as to kind of help pull the allergens out, or add some things in there if something's going on. Certainly immunotherapy. So a number of patients will use allergy shots. So each shot contains basically a minute amount, a dose of the allergen. And so over time, your immune system becomes desensitized to the allergen as it learns how to tolerate it. Typically, shots are given weekly to monthly for a period of time, most of the time for about 3 to 5 years. After this amount of immunotherapy, the person generally kind of reaches their max tolerance to the allergen. So the immunotherapies injections are discontinued, and the person remains generally more tolerant than previous to their triggering of the allergies prior. Again, that some people are all for that, some are against it. It does take time. So plus or minus. Certainly, we do have compounded options to help. Anything we make in the lab does require a prescription. LDN, which stands for low dose naltrexone. I love LDN. If you have anything autoimmune disease related, absolutely talk to your doctor, talk to one of our pharmacists about getting on, how we can facilitate you getting on low dose naltrexone. Helps with immune functions, also helps decrease inflammation. It's a variety of different receptors. Sinus rinses, sinus nasal sprays. We can also do topical creams, gels. Ketotifen is a great thing to kind of help stabilize the mast cells. So there again, we can compound a number of different things, even that you can use in with that neti pot or the Neomed. Again, a lot of times your practitioner will do a culture or a nasal swab, culture that out, and then we can use antimicrobials to go specifically after what's going on. We can also use anti-inflammatories as well. So now on to supplements. So really what I wanted to kind of do is pull in what do I have in my tool bag? And this certainly isn't all encompassing. It's not everything, but what are the main things that I gravitate to, that I go for? So we're going to kind of go through these one at a time. And I do like to remind everybody, if you've listened to me or have seen me as a patient, really there's a certain amount of baseline, right? It's like building a house that we need to be on. So this goes without saying. I recommend to every patient, we need to be on a therapeutic multivitamin, so key. with methylated Bs. And why methylated Bs? Half the population has what's called an MTHFR deficiency. It's a genetic SNP to where you're not able to metabolize out the folic acid and or B12 properly, which is, we see an increase in cardiovascular as well as neurological and a whole host of other diseases. So having that multi on board. Omega-3 essential fatty acids. So our pure omega 1000, it contains 1,000 milligrams of EPA and DHA per capsule. We have a company in Norway make that for us, so it's extremely clean. If you're like, oh my goodness, I can't swallow that capsule, and it's, you know, it's a pretty decent size soft gel. It is a soft gel, so that's going to go down typically better than a capsule. But we do have a liquid version of it that's 2,400 milligrams of EPA and DHA per teaspoon. So typically we'll use 1 to 2 teaspoons per day. I got to tell you, you may be thinking, oh my goodness, Baylor, that fish oil must taste nasty. Oh my goodness, it is extremely clean. I do recommend refrigerating it. That does help, but a very slight fish taste. Also, vitamin D3. Generally, I like to have some K2 in combination with that. K2 is going to help with the absorption of the D, help drive the calcium into the bones, and help keep the calcium out of the arteries, so helping to decrease atherosclerosis. D helps with the immune system. D helps with inflammation. So you can see there's a little theme here, right? Inflammation and immune. Also CBD, I'm a huge advocate of CBD. It hits 220 systems of the human body. Generally, I'm going to start with about 15 milligrams a day and increase that dose up. For general, general overall health, I generally target about 20 to 40 milligrams per day. And then I'll increase that much higher if needed, if someone has something going on. Okay, so those are kind of baselines. That's what you should be on anyway. Just so happens, guess what? CBD helps with gut. It helps with inflammation, helps with immune. Vitamin D, immune, inflammation. Fish oils, same. Multi, again, really kind of helping the whole system. And the methylated Bs are going to help balance neurotransmitters and help with the metabolism of your amino acids, so we can help with those pathways for the neurotransmitters. So kind of bookending this with, I think, probably two of my main go-tos. The first one is all-season support. So this formula has a variety of herbals to help with exposure to things and help with that really histamine balance. So you can see this has amla in it, has some astragalus, some mushrooms, some black pepper, some ginger, also quercetin, nettle, turmeric, ginger, bromelain, feverfew, and some really an antioxidant blend in here, which really is going to do more than anything, really help with the absorption and facilitate the absorption of the rest of this. So where I'll use this is seasonal allergies, as well as helping with congestion, runny nose, that sort of thing. Non-stimulatory, also non-drowsy. So it's not going to hype you up. It's also not going to put you to sleep. So dosing on this, depending on your severity of symptoms and where you are, I'll have some patients that can get away and use just 1 to 2 a day just for maintenance, as an alternative to their synthetic antihistamines, your Claritin, Zyrtex, etc. But if it's, oh my goodness, Baylor, I am just dying right now, ragweed's gone through the roof, neighbor just put down mulch, so mold is really slamming me, we can go up to 2 tablets 3 times a day. So although that dosing may seem overwhelming, what's nice is it puts you in the driver's seat. I like to have a product when symptoms really get exacerbated that you can increase it up and really to help settle things down. And some of these individual agents we're going to be talking about more specifically in a moment. Okay, quercetin complex, kind of similar in some aspects to the all-season support. I don't want to necessarily call it a watered down formula, but it doesn't have as many different agents in it. Now, for some, this is a good thing. For others, it's a bad. So the reason why I like having a variety of products is, let's say you're allergic to mushrooms. Well, this has reishi mushroom in it. Okay. The quercetin complex doesn't have mushroom in it. Okay. So I like having things that we can go to pivot if we need to. So quercetin complex, similar to the other, helping with that immune response, helping to serve as an anti-inflammatory, stabilizing the mast cells, similar to the all-season support. Some patients you may find, hey, I can get away with 1 or 2 a day, but if symptoms are really increasing, then slam it up to 2 capsules 3 times a day. Also, a little bit different. This is a capsule. All season is a tablet. So again, I have some patients that prefer tablets, some that prefer capsules, some that it doesn't matter. Just, give me something, right? Quercetin by itself. So quercetin really kind of, I tell you what, with COVID, it really gained popularity, right? It was certainly on the FLCC protocols. Again, mast cell stabilizer, anti-inflammatory. You can slam the dose if you need to. You can take anywhere from 1 a day take it up to 6 total a day, 2 capsules 3 times a day. Very well tolerated there. Again, why would we break this out? Well, if you've got an allergy or a sensitivity to, let's say pineapple or some of the different flavonoids, and we need to pull that out separately, then we've got quercetin by itself. NAC. NAC stands for N-acetylcysteine. N-acetylcysteine is a very potent antioxidant. It's going to help support overall wellness, hitting on the lung, liver, kidney health, as well as immune function. It is an amino acid that helps, especially with that respiratory health and immune function. It's also going to help with the addition of increasing glutathione levels, which glutathione is going to help with detoxification and helping to resist that oxidative stress at the cellular level. Typically, we'll go anywhere from 1 capsule a day to 1 twice a day. Colloidal silver, great natural antimicrobial. So you can take this either orally. You can take 1 teaspoon up to 4 times a day if you want to. I'll have patients use it topically. We'll also have you add it to a neti pot or sinus rinse as kind of I'd say poor man's antimicrobial, but I mean some of those things can get expensive, right? So colloidal silver, very well tolerated. They've decreased the particle size on this, so you'll notice that we've got a low parts per million, but yet because of the particle size increase, it's increasing the effectiveness of it and the absorption. So we're able to get away with using less. So we don't have to worry about silver toxicity. Zinc. Now we can do zinc orally. There again, zinc orally came into favor big time during COVID times. But these as lozenges, what happens is it helps with that viral shedding. So this also has some vitamin C in it, as well as some other flavonoids to help with absorption. So basically suck on 1 lozenge up to 3 times a day. So that's going to help with the mucous membrane. So help with shedding that virus from the nasal passages. Mushroom immune support. So this is a multi-species mushroom blend, overall hitting the immune system anywhere from 1 capsule once a day to twice a day. And you'll notice we're very good we try to be as free with gluten and allergens and sensitivities as much as possible, non-GMO, vegan. So we're very aware of that. The products that we have made are as clean as possible. Turkey tail mushroom is another mushroom that we'll use for immune support. Certainly, the mushroom immune support there again has 6 different species, one of which is turkey tail. But then if we've got somebody that wants to do turkey tail more specifically and just focus on that, this does also spill over, helps with cognitive function, exercise, gut health, decreases inflammation. There's data on it lowering blood sugar for folks with type 2 diabetes. So that's kind of why that's kind of segregated out as a separate one. And again, 1 capsule up to twice a day. Echinacea has been one of my favorites for many, many, many years. You can use echinacea both from a preventative standpoint as well as a treatment piece. It is going to help with infections. It is going to help with viruses. And it's also going to help shorten that recovery time. So what I tell you is, if you feel like you've got something coming on, or you think you've got something coming on, start echinacea immediately. and take it until you feel like you're over whatever is going on. So this is an alcohol-free tincture, okay? Typically, if you're going to do that, do 40 to 60 drops, and you can go up to 4 times a day. We also have it in capsules. Capsules, again, you can go up to 4 times a day with that as well. Does one work better than the other? No, both work. Some prefer liquid, some prefer capsules. So we've got it both ways on that. So certainly for pediatrics, to where you're having a harder time or not able to swallow a capsule yet, that's where the tincture comes in. And of course, this is alcohol free. So if we're dealing with folks in recovery, or again, pediatrics, it works great for them. You can add this to a beverage if you want to, absolutely fine. Also, I do want to touch on, there was some very, very old data. There's lots of myths and that sort of thing. One old myth that was out there was, well, gee, you can't take echinacea indefinitely because it's just going to keep stimulating the immune system. No, that's false. It's not going to just keep going. You're going to get a plateau, right? It's not going to go beyond a certain point. So you can take echinacea long term. So it is safe to do for that. I did just want to mention that because that does come up from time to time. Elderberry syrup. The herbal name for this is Sambucus nigra. I like the taste of this. I think it's an interesting kind of mixed berry fruit, if you will, flavor to it. Does great for immune system, antioxidant, anti-inflammatory. This also helps to decrease the length and severity of colds. So you can imagine when I feel like I've got a cold or something going on, man, I'm slamming the echinacea and I'm taking my elderberry. Absolutely. I actually travel with both of them. You'll notice this bottle, we have it an 8 ounce. We also have a smaller size as well. That I believe it's 2 ounces, so it's safe to travel with as far as with TSA. Dosing on here is 2 teaspoons, which is 10 mLs, up to 5 times a day. So slam it. Now, I have on our slides, we do have adult dosing. So you can use all of these things for pediatrics. I did not include all of that today, really, because if you've got a pediatric patient, it kind of varies depending on the weight and the age. So I'd prefer you to engage one of our pharmacists or staff for that, for dosing for, if you've got pediatrics. Ginger rescue. So a lot of times when you're sick, you feel nauseous. So ginger helps with nausea. It's also a great anti-inflammatory. You'll notice it was in there is some ginger in the all season support. Okay. Also helps with digestion. Anywhere from a half to 1 teaspoonful, you can take it as needed. You're not going to overdose on it. Shake well prior to use. It is going to settle out. And of course, it's ginger flavor, so it does have some potency to it. If you want to mix it in a little bit of water to dilute it, that's absolutely fine. You can do that. Vitamin C, Linus Pauling has done fantastic research on vitamin C. So this is certainly an oldie but goodie. You notice, we've got BioC, with bioflavonoids, we've got whole food-based vitamin C, you name it, we've got it. Tablets, capsules, powders, chewables. I didn't want to include them all in here. Didn't want to overwhelm you. But ultimately, it helps with optimal immune function. It is important in collagen production, which can enhance skin, nail, and hair health, supports healthy tissue and cartilage formation. So it is beneficial during wound healing and injury repair. Plays a vital role in phase 1 liver detoxification, plus it's an antioxidant properties that protect against the toxic effect of heavy metals. It does also further help with glutathione and potent antioxidant for phase 2 liver detoxification. Mentioned in wound healing, but also I'll also use it, post-surgical as well for healing post-surgery. Probiotic. Touched on that just a little bit when we spoke about gut health, but our 35 billion probiotic, it does have 8 different strains of bacteria in it. It is shelf stable. It's stomach acid stable as well. So think about immune health, think about gut health. Typically, best time to dose probiotics is at bedtime. Typically, most of us aren't going to bed on a full stomach. So it's a great time to inoculate the gut while you're sleeping and not adding, eating while you're sleeping. Active immune support. So this is my other bookend. I started with all season support. Active immune support work to put together really during the beginning part of COVID. So you'll notice a lot of this are things that you've seen out of the FLCC protocol for COVID. It does contain vitamin C. Can we go higher on vitamin C? Yes, you can. It does have some zinc glycinate in it. NAC, EGCG, which is a green tea extract. Great antiviral properties to it, and quercetin, which we've spoken about already. So this has all of those in one. So typically from a Baylor, I want to take something from a prevention standpoint. I'll generally do 1 to 2 capsules a day for prevention. Then certainly if you are feeling like you're coming down with something, you're sick, or you've had a family friend, whatever, that's been exposed to COVID and you're afraid, oh no, well then I'll absolutely slam it, do 2 to 3 times, 2 capsules 3 times a day until well. So that's been a fantastic formula and has worked well. Now, what we've also found is with that EGCG in there in this formulation, so I'll use it for Epstein-Barr virus, as well as a whole host of other viruses, as well as my autoimmune patients. It's working very nicely for. So not just our colds and allergies, but other viral etiologic sourced infections. So again, going back to baseline, I started off reminding you of this. I want to kind of finish with that so we understand the importance of that, right? So our multi, our fish oils, our vitamin D, the CBD, plus, of course, depending on age, calcium, right? And bone density, which, we tend to think that more of a female thing, but don't forget about it for us guys. We're at risk too for osteopenia and osteoporosis. Typically when it's diagnosed in a male, it's far more severe because you don't find it in a male until it's far more advanced. So don't forget that calcium for bone health. Certainly quality, big stickler for quality. I'm a pharmacist, but been trained in functional medicine, integrative therapies, vitamins, minerals, herbals, homeopathics, the list goes on. So I'm used to pharmaceuticals to where it is what it is, right? The same with the companies that we deal with. I deal with companies that are registered with the FDA, following good manufacturing practices, doing third-party analysis, testing, dissolution, disintegration, mass spectroscopy, liquid chromatography. And so we're dealing with supplements that are what they're supposed to be, and they're also not laden with things that we don't want in there. So you may be thinking, all right, how in the world do I get started? Where do I start? Well, one, you can get started on some baseline supplements. If it's just also you've got some allergy stuff, well, think about the all-season support. Or if you want to strip that down and just start with some easy quercetin. You could also do, if you've got some congestion, adding in the NAC, or certainly that's where the all season with the combo product helps. You can go online and order. We've got a whole website, web store there that you can order all of these different things we went over. If you're to the point that, okay, wait a second, I'm complex, or I've got tons of disease states, I've got a bunch of different meds, I want to call and set up a consultation with someone to go over these things, you can reach out. Our patient care coordinator is Allison. You can reach Allison at patientcare@revcustomrx.com. She can get all the forms to you, get you set up. We do those via phone, via Zoom. If you're local to where one of the practitioners are, then you can certainly go. I've consulted patients all over the globe, so not a problem today. I actually had a patient that came down from, I'm in Richmond, Virginia, but drove down from Maryland because they wanted to see me in person. That's fine. I've had people fly in. That's not a problem. Again, I go to, you're the boss, you're in charge. We're here to help educate, guide, get you to where you want to be for your health. Okay. Again, you've got a whole network of pharmacies across the US. We're certainly adding more every month. So if someone's not in your back door right now, we may have somebody there soon as well. We do ship all over, so we can certainly handle all 50 states. That's not a problem at all. So reach out, connect with us on YouTube, certainly Instagram, all of the fun social medias, as well as we've got a whole host. We're recording this webinar today, and you can go on there and see some of the other ones that are already recorded. You can watch them. We've got chock full of information for you. So with that, I wanted to make sure we left some time today for some questions. So there is a little button now, whether or not you've got the toolbar at the top of your screen or the bottom of the screen, depending where you've put it. But there should be something that says Q&A. You can click on that and you can type in a question and we'll get that answered for you. So I'll give you a few minutes to type in those questions. And while you're doing that, certainly, again, I want to thank you for your attention today and for joining us. For those that have joined live today, we will be getting out the link to the recording. Generally, that's emailed to you within a couple of days, and Tara will get a copy of the handouts sent to you too. I had a question come in about can you do the neti pot and also take all season support? And the answer on that is absolutely yes. There again, you can do the neti pot with just like a saline packet or your pink Himalayan sea salt. So that pink salt, right? That natural salt. Put that in there, or depending if you've got kind of more infectious type stuff going on, or you think you've got something happening, then put in about a teaspoon of colloidal silver in there along with the salt, and that'll help with the microbe balance. All right, folks, any other questions? I'll give it just a moment here for you to put in anything else today. All right, guys. Well, I don't see anything else, so we'll call it again. I want to thank you for your attention this afternoon, and certainly be on the lookout for our next webinar. We'll be adding more and more to the bunch, as well as the recordings. Check out the YouTube channel. We've got stress, adrenals, thyroid. We've done heart, women's health, as well as CBD and Delta products. So with that, I want to thank you all and have a wonderful afternoon. Thank you.